Dévora.
Thank you, and I'll pretend I'm not, I haven't heard your task of speaking on behalf of 200 countries in 5 minutes, so I'm going to speak on my behalf. This is easier. I think that there are only a few things I want to say. In the area of research, I hope I'll say it in a right way. I think that we know a lot more than what we do about what we know. It's welcome every kind of research that is being done, but I wish we were able to implement even a third of what we already know. So sometimes when somebody comes to me, say, we want to do a research in the country such and such to see if what's the stigma towards mentally ill, I'm kind of, okay, we know already that there is stigma. Why don't we do something to change that instead? Mm-hmm. So that is what I would like to see in terms of research. In research that is research of services, research that is intervention-oriented, action-oriented, that will help those who need that help to change, reshape the situation. Then, of course, that there is still a lot of other very specific research needed. But if at least half of that resources available are used to start changing things, I think will help a lot. And that is, of course, related to programs, because I would like to see more about what works. And when I was listening to the last presentation earlier about evaluation, I was wondering why we haven't heard some of those programs instead presented, in terms of learn more from each other, evidence-based practices or practice-based evidence, if I get it right. Things that we know have worked enough in order to keep trying them. And again, I don't want to sound too materialistic, but the funds that are spent on some issues could be spent on something else. That's what I'm saying. Scarcity of resources everywhere. How do we use those limited resources in the most efficient way? Then in terms of policy, I think that we heard yesterday talking about the institutionalization as an old-fashioned thing, and I think it's very actual, and it should still be considered as a policy. It's not something that happened here in the 70s or in the 60s, whenever it happened, since you still have the problem of beds that are not there and alternative services that are not there either. And so I think that we can call it in different ways, but the issue of closing down those institutions, name them mental hospitals or prisons, where people are deposited there because there are not services out there in the community for the families, for the communities to deal with those problems. I think this is still a big issue that is common here as much as in the tiniest island we work with, is developing community-based mental health services, a network of services that will answer to several needs, including the need for a bed, but not only that, is something that should be, I think, the priority policy direction that we could all benefit from. And of course, using the lessons learned from countries like this one that has gone through a lot and has achieved a lot, but still has learned that many things did not work as was expected or planned. We all know already, I think, that closing these hospitals to develop other kind of services with those resources is not what we are talking about. We are talking about shifting resources, and this is something that still needs to be seen everywhere. If we have a comprehensive network of services, community-based mental health services, in my opinion, that is going to be the best way to prevent violence out there. Thank you. I didn't even see the paper there.